And my main focus is like, it's not about getting your body back. It's about feeling good in your body again, regaining strength, maintaining strength, stuff like that. So like that mommy tummy doesn't have to be part of your life. You might not look the way that you looked before you got pregnant, but you're going to feel stronger.
Welcome to the Fit and Healthy Denver podcast, where we discuss all things revolving around health, fitness, and wellness in the amazing state of Colorado, so you can get behind-the-scenes information from industry insiders, special events, and more. Coming up is our host, physical therapist, and strength coach, Dr. Jamie Beauvais. And here we go.
So this is a part 2 episode, so if you have not listened to part 1, you don't have to listen to it before, but definitely listen to it after. There is a ton of great information in there. So in this part 2, when we're talking with Carrie and Dr. Courtney, we talk a lot about how breath work enhances exercise while your pregnancy is going on, as well as before and after. When it's safe to return to exercise after pregnancy, what to avoid after pregnancy, the things when you should see a pelvic floor physical therapist, how to determine if your back, hip pain is actually coming from something else, what's the one simple exercise you can do to start improving your pelvic floor, the 5 P's to know, and the best way to heal diastasis recti, or some people call it mommy tummy, and when to go to a personal trainer versus when to go to a pelvic floor physical therapist. All right, stay tuned to the very end because we've got some interesting things that Dr. Courtney has offered our listeners. So stay tuned to the very end. It's a good one. Okay, so I know people will have questions because you've mentioned how you train the breathing and how that works in with the pelvic floor, but I know people will kind of want a little bit more from you. So just tell us a little bit more about how you train these muscles and exercise, and like how, let's say, what would a session look like with you? And I know that's a general question, but what would a session look like with you?
So I always talk them first, like, what's going on in your body? What are your goals? All of that stuff. So simple questions of like, are you leaking? Are you not? If I asked you to do a pelvic floor contraction, would you know how? And then we go from there. So then I just watch them breathe. I'm like, okay, take a deep breath for me. And more often than not, their shoulders travel up towards their ears. So that shows me that their diaphragm is in fact not traveling down. And we got to work on just a breath pattern in general and retraining that breath pattern. As a society, we're very shallow breathers. We take a deep breath and it all comes up instead of going down and out like it should. So we start there. And then I start to check on that breathing pattern in different positions. So in a tabletop position, so on hands and knees. And then can you do a bird dog and keep that pressure canister intact? Can you extend an arm and a leg without changing the shape of your back? Do you know the difference between engaging your transverse abdominals versus just bracing your core, which is a very different thing. So I think especially women that come from the CrossFit industry and that side of fitness, bracing is a very big tool that they use. And bracing does regulate the pressure in your canister and protects your spine, but it's not a super functional way to engage your core. And there's times for bracing.
Because they're bracing so hard and it's kind of hard to do other movements.
Yeah. So like if I just told you to brace your core for a punch right now.
Yeah.
And can you take a deep breath
right
at the same time? No, you can't. Yeah. So if you fully engage your core in a functional way from the bottom up, you can still talk and have a conversation and maintain that contraction in your core and like go about doing some other things with your body, which is cool. So I teach the difference between bracing and engaging. And then we just keep working on that breath movement within movement patterns. So like, can you do a squat and inhale as you travel down and then exhale as you contract and lift up out of that squat? And then you can actually feel your pelvic floor working and you can start to connect into the difference of like lengthening and contracting. So a typical session with me would start with breath work. We would move through some actual exercises. You're not just breathing. I'll promise I'll get your heart rate up and get you stronger. But it will always be functional and catered to the individual. So if you have to work on lengthening your pelvic floor, we'll be working on that. And if you have to work on tightening things up, we'll be working on that.
And I have to imagine the difference between bracing and engaging only gets more important the bigger you get throughout pregnancy as internal pressures and internal sizes and the way you have to move changes.
Yes, 100%. So like we talked about earlier, your six packs abs are basically what you're bracing. You're bracing your superficial muscles. You're bracing your paraspinals and your six pack abs usually when you brace. Because you just think like, tighten up and like trap that air. And when you engage, you're bringing that air out so that you can fully take another big deep breath in. And as you get bigger, that pressure outward along that midline is super important to regulate. So if you can connect in and engage your transverse abs, you can actually hug your baby up and in, make your bump smaller and bring your belly button up, then you can learn how to really engage that transverse abs. So while you're pregnant, it's a great way to actually connect into that muscle group because you have such an awesome visual to watch it happen.
Cool.
Carrie, I'll just say too, because I've seen you do it with videos, you are so fantastic at not only explaining it, but describing it every single time you're doing some type of movement, whether it be like the simplest of exercise or you're going through squats or something like that. You are so conscious about the breath work of it. And I love how you tailor that in with everything, because a lot of people in general don't even realize just how simple what breath work can add to their body, let alone women, especially after pregnancy, and how important it is. So I think you do a fantastic job of it.
Thank you. Thanks, Courtney.
All right. So we've talked a lot. So hopefully everybody can now see the benefits of strengthening, of working on breath work, building the pelvic floor during pregnancy, pre-pregnancy. Let's talk a little bit about postpartum issues. So when is it safe to return to exercise after pregnancy?
So the general rule of thumb in like the medical field is 6 weeks. And that magic number is tied to stitches. And that's it. So typically if you tear after giving birth, you have stitches, and stitches dissolve within 6 weeks. So that's why you have a 6-week checkup. There's absolutely no other reason that it's 6 weeks. So that is like the baseline, and that's like the minimal amount of time that you should take. Another thing to keep in mind is that like that organ that you grew to help grow your baby, your placenta, leaves a dinner plate size wound inside of you, which is, it's a pretty powerful visual. So you need to heal that too. So the general rule of thumb is that you're no longer bleeding, you're no longer in pain, and, you're feeling like it would feel good to move your body in a new way again. So, resting is super important. Your blood volume doesn't return back to normal until 8 weeks, which is not talked about often. And it also is very dependent on the type of birth and labor and delivery that you experienced. C-sections can take a little longer to heal from. Vaginal births can take a long time to heal from, depending on if you did tear, how severe that tear was, if there were complications. There's, a whole host of things that need to be considered, but the very minimal amount of time is 6 weeks.
I'll say too, just from a physical therapist standpoint, a lot of this is going to be dependent, kind of like Carrie said, on the birth and the woman and everything like that. But there are definitely certain exercises that you should wait a little bit longer. And in general, you would not want to just directly the day that you're cleared from the doctor or you feel better, just go do. So for example, some of those, especially like as far as like making sure you can train the pelvic floor and your diaphragm as well, like doing crazy amounts of heavy lifting right away are not going to be good. And a big one is running, because we have a lot of runners, and runners love to run. Even women will still run like all the way up until they give birth. And it's going to be dependent, but typically you actually want to wait a couple months. You really want to make sure that you've dialed that pelvic floor in. And then also, just from an orthopedic standpoint, aside from the pelvic floor going through lots of changes, the rest of your body is too. Your hips, your SI joint, your back, all the muscles surrounding your upper thighs, your adductors, abductors, everything like that can get really tight or weaker as well. And so before you go out and do these heavier activities, you're definitely gonna want to make sure that you're cleared in that sense, and that you can not only make sure your pelvic floor is okay, but that the rest of the musculature and your posture has returned as well, or else you could cause other injuries.
Okay. And so, Courtney, I think I've read a statistic, and correct me if I'm wrong, that something like 80% of women have SI pain, low back pain with pregnancy, and they could benefit from physical therapy. And that may or may not be kind of pelvic floor. It may be more orthopedic, outside, kind of work in the joints and muscles. So when I've talked with OBs, they have, or OBGYNs, they have told me that essentially 100% of women would benefit from a pelvic floor therapist working with them after rehab. So they don't really give any timelines on that. And you've kind of told us why they need to be able to do certain things. Can you make it easier for somebody to try to know when to, we've kind of talked about when to return to fitness, when to use somebody like yourself to help speed up the process of getting back into an active lifestyle?
Of course. Yeah. Again, it's gray area. It's going to be dependent. I hate saying that. But similar to what Carrie was talking about, usually as far as pelvic floor therapy, 6 weeks, just because you do want to make sure all the bleeding has ceased. If there were stitches or things like that tearing, we definitely don't want to be doing internal exams when all that stuff is still trying to heal, or say there was it could be an infection or something like that. We always just want to make sure that area is cleared first. But then, as far as kind of the outlier stuff, so say whether it's SI, hip, back pain, there's still some other minimal things that can be done prior to coming into pelvic floor and actually digging into the internal stuff. And we talked about it a lot, but something very simple and basic is just diaphragmatic breathing, working on breathing, things like that can kind of start to heal up and work your way into pelvic floor therapy. But for the most part, I think I would be definitely doing a disservice to women if all I did treat was just the pelvic floor. No matter what, it's all a kinetic chain, is what I say. And I think that not only can women benefit from pelvic floor therapy, but I think that you kind of have to treat the woman as a whole, because during pregnancy, like Carrie mentioned, there are so many changes that are happening postural wise, pelvic floor wise, and back, hips, SI joint, all of it. So as far as all of that stuff goes, you can definitely find, at least with a treatment from me, that there's going to be some form of all of that being taken into account.
And I know some problems like hip pain, back pain, they can actually be referred pain, meaning that pain isn't actually coming from the back of the hip, but it may be coming from pelvic floor, or I'm assuming some other areas as well. How would somebody after they've had a baby know when that pain is coming from something else? So let's say I have hip pain. How do I know that stretching isn't going to get rid of it and it's actually coming from something else, and I'm really working on the victim and not the culprit?
Right. Well, the easiest answer is definitely going to be coming in to get a checkup, some type of pelvic floor therapist, of course, because they will not only be able to ask the appropriate questions to kind of dive into, when do you get the pain? Is it during certain activities? Can you point to where it is? Is it sharp? Is it dull? Numbness, tingling, all that kind of stuff. They can do like a background check of that. But then, of course, doing an external and an internal pelvic exam is going to be really important as well, because like a lot of things in the medical field, stuff can be missed all the time. And I've seen it with patients before where, that they've gone years with thinking that, it's my hip and it must be, a labral tear, or it's just this really tight muscle. And they've gone through all these different practitioners and no one ever thought to ask them a basic question of, is sex painful? Is inserting a tampon painful? Is there leakage? Like all of these basic questions that come as far as pelvic floor goes that are completely missed. And if someone would have just stopped and asked those simple, basic questions, it could pretty much lead you right to pelvic floor therapy. And so that's something that as soon as I kind of hear a red flag from a woman, whether we're, speaking as far as if they're coming in saying, and I am treating them for back pain or hip pain, and all of a sudden I hear them say something where I'm like, wait a minute, that doesn't sound right. That doesn't correlate at all. Let's dive into this a little bit further. And so, yeah, very much so, just like any other parts of the body, things can refer pain. But I think ultimately getting to the root cause and asking those questions, which some providers, I think, maybe just get a little bit frazzled to ask, but they're so, so important because big things can be missed, and patients go years, doing regular therapies and all these other practitioners, possibly even MRI surgeries, when really at the end of the day, it could have just been something simple like pelvic floor.
Sure. And I think, I've learned a lot from both of you today. And I think the thing that I've kind of taken from this is, there are personal trainers, and then there's somebody like Carrie who has really specialized in this kind of discipline, and the same thing for you, Courtney. So the thing I'm learning from both of you is, while, yeah, maybe a personal trainer can help you with some general fitness, this is beyond general fitness. So really work with somebody who's kind of a specialist of their field, and who can listen for those very simple things. Like that's maybe a simple question that somebody else wouldn't think to ask can give you, I don't want to be too dramatic, but life-changing results. So, yeah, that's really helpful. I think, so a lot of these questions today were asked in our Facebook group, the Fit and Healthy Denver Facebook group. And so, I want to ask, there's only one more that I have left that was put in the group. And so you've answered part of the first one, which was, do women really need to settle for having bladder issues after giving birth? Which I think is pretty clear no, as you are both vigorously shaking your heads. So what should women do to help the pelvic floor? Now, I know the answer from both of you is it depends and it's very individualized, but the answer somebody wants is just give me something to start with, right? So is there something that is a fail-safe? Yeah, maybe it's not the most effective, but it will help a little bit that we can give our listeners?
Yeah, I can. I'm going to jump in here. 100% diaphragmatic breath. That's your number one tool to connect to your pelvic floor, to get it to function properly, and as a great starting point of like, do I even know where my pelvic floor is? I think the reason I got into this field is because I had no idea that I needed to worry about diastasis recti or prolapse or my pelvic floor. I was like, I'm just having a baby. Cool. I can still do push-ups. I can still do this. And I couldn't. And after my first baby, I was dealing with a whole host of issues and like nobody knew how to help me. So diaphragmatic breath is definitely the number one. And then number two is like after you connect that area, feeling it function. So like when you do a hip bridge and you add some weight to it, do you feel pressure downward or do you feel like you have control? Do you feel like you're going to pee or do you feel like you have control? So starting there of like just connecting into it and feeling it for maybe the first time. And then learning how to engage your core in a way that regulates that pressure. That's the number one thing. So my favorite thing are the P's. So if you feel pain, pressure, peeing, or popping, then you need to either back off or reconnect. So those are some things that you can think about, like while you're moving, while you're running, while you're doing squats, when you pick up your kid, when you lift groceries out of your car, like everyday movements, check in with those P's and see where you're at.
Yeah, don't just keep doing 100 crunches every day, ladies, no matter what TV or anybody else tells you. You've got to make sure, like Carrie said, that you are engaging the core appropriately, not just trying to brace and suck in and take all your breath away and just do a bunch of crunches. You're only going to end up doing more harm than good.
Yeah, I could talk about that for another 2 hours. Like, don't ever do crunches again.
Yeah, never. It's awful.
And Carrie, you touched on it, but kind of the other big one that I know of is after pregnancy, diastasis recti, or some people are going to call it mummy tummy. And I know crunches with that is kind of a no-no, especially depending on how big it is. But maybe is the focus, is it similar to what you're working with, kind of where you're building the canister? Is it different? What needs to change in order to work on that?
So diastasis or diastasis recti is the stretching of the tissue between your six-pack abs. 100% of women experience it by the end of their pregnancy because your belly has to stretch. But the difference is that it's either injury-based or it's normal. So if you injure that tissue in a way that prevents it from coming back together, we'll say within 12 weeks postpartum, then you know you have some work to do. And regulating that pressure within your abdomen is the best way to heal it. So if you're constantly putting that pressure outward, then it's never going to get the chance to heal. But at the same time, you need to challenge it enough to teach it to turn back on. So it's a lot harder to train tissue than it is to train muscle, but it does want to come back together. And the best way to do that, again, is starting with that diaphragmatic breath. If your breath is functional and it's the mechanics of it are working properly within that canister, then you're going to help mitigate the dysregulation of that pressure outward against that tissue. And when you do crunches, if you think about what's happening to that canister, like think of a Coke can and then you try to bend it in half. Like, where'd that pressure go? Nowhere good. So we don't want to do that. The best way to heal diastasis is to regulate that pressure. So like starting in a bear plank when you're on hands and knees, so you have a lot of support. Can you hover your knees off the ground without feeling that pressure outward or downward? Then can you progress to an elevated plank? Things like that. So you still want to challenge it, but you don't want to beat it up. And it all comes back to breath, 100%. I know it's so boring. Like, I breathe every day, but if you're not breathing right, then you're not doing anything good for your body. So.
Nice. Okay. Courtney, anything to add on that? I think she did a great job explaining it, but anything else you want to add?
Yeah, no, I think I have one last question for you, Carrie, because you gave birth during this quarantine. So as far as kind of what we're going through right now with COVID and everything, do you think that there's a new set of challenges for women who are pregnant or have just given birth or are about to give birth because they're going to be at home more, going back to work possibly, still at home, postural wise, things like that?
Yeah, 100%. So first thing, my 6-week checkup was virtual. So it kind of fell on my shoulders to communicate, like, do I have a diastasis right now? Am I feeling pressure on my pelvic floor? Because mostly it's focused on postpartum depression rather than like your physical body at that point. So you really have to advocate for yourself right now. And like, if you feel like you need to be seen in person and you're comfortable with it, then you got to push for it. And then just being an advocate for yourself in general, like seek out a pelvic floor physical therapist because your OBGYN is not going to tell you about it. 85% of the time, they're not going to tell you about it. So you have to seek that out yourself. And then another challenge is, we're home, we're sitting a lot, and now you're also feeding a baby, whether you're breastfeeding or bottle feeding, you're sitting with your shoulders probably rounded forward more than you're used to, and you're also sitting a lot. So your glutes are all of a sudden turned off, your pelvic floor is taking a beating from you sitting, and a lot of downward pressure, and you're crunched forward in that canister now, so that pressure is all going down and out in a way that it shouldn't. So just, being mindful of your posture, activating those back muscles, stretching your chest, things like that are going to be hugely beneficial to you if you cannot get into a pelvic floor PT or to your doctor, if that's something, that you're not comfortable with doing in person yet. Hop on a Zoom call. We're all here for that. I do Zoom sessions, and I'm sure Courtney would too, just to see where you're at, see what you'll look like with your body. And just my best advice is to advocate for yourself because no one's going to do it for you.
All right. So I've got one last question for us. So you both work with ladies during pregnancy, postpartum, and we didn't talk about this, but Carrie, I know you also work with ladies in pain. Courtney, you work with ladies in pain as well. How would somebody, let's say after pregnancy, know when to see Carrie, and how would they know when to go see Courtney? So how would they make that decision, in other words?
So I would say that mummy tummy look where you're like, hey, I still look like I'm 3 or 4 months pregnant and I'm 6 months postpartum. Oh boy, sorry. Hold on. I'm getting a phone call on my computer.
Happened to me while ago too.
So that mommy tummy, that distended belly look, that's a sign that your core is not healing properly. Leaking too, like bladder leakage. And then if you're still in pain to the fact where you're like, you can't be on your feet for a long period of time, or it's not comfortable to go for a walk, you're having pubic bone pain, SI joint pain, your hips are popping, you're hearing noises left and right. That's a sign that like you're not necessarily healing in the way that you could optimally be healing. So outside help is what you should be seeking. And then also just treating it as self-care. Like you're a new mom, all the focus is on your baby. When's the last time somebody asked you how you were doing? Like take that time for you and seek out the help that you need. And it's going to feel good. It's going to feel like the best time or money you've spent on yourself in a long time. So like, again, comes back to advocating. And if you're in pain, you don't have to be. So any level of pain past that 6-week mark, seek help.
Gotcha. Courtney?
Yeah. And I think too, just as long as everything checks off okay, I don't think that there's any issue at all with seeing someone like myself or Carrie at the same time too, and working together. I love being able to do like co-treats, I guess, if you will. I think it's going to be more beneficial for the patient. I learn more, Carrie can learn more. We can kind of be in tune with everything. So yeah, as long as the woman's not experiencing, a crazy amount of pain, or she's at least able to, fire her pelvic floor muscles, fire her diaphragm, then yeah, you could definitely seek treatments like both of ours at the same time as well.
Okay, great. All right.
With one stone.
All right, so let's wrap up because I want to be respectful of both your times. Let's put out some socials out there so people can follow you. And so let's start, Courtney. Where can people contact you?
So people can find me both on Facebook and Instagram. So we're Kinetic Chain Denver, but it's spelled KINETIK. Chain Denver. And we've got blogs on our website as well, kineticchaindenver.com. Anything from leakage, bladder stuff, diastasis recti, pelvic floor pain, all that good stuff. You can go and check it out.
And Courtney, you are very soon putting free reports on the website for leakage, for mummy tummy, for pelvic pain as well, that people can download for free on little simple things they can do to help themselves.
Correct. Those are just getting finished up right now. Yep. Mm-hmm. They're a couple pages long, but they've got tips and tricks on them. So that's something that you can check out as well.
Perfect. And Carrie, where can people find you?
I am on Instagram, carrieaudi.fit. Same, email me, carrieaudi.fit@gmail.com. And you can find me at Pearl Street Fitness in Wash Park all the time. I pretty much live here. And I do sessions out of here. I also do virtual sessions. And my main focus is like, it's not about getting your body back. It's about feeling good in your body again, regaining strength, maintaining strength, stuff like that. So like that mommy tummy doesn't have to be part of your life. You might not look the way that you looked before you got pregnant, but you're going to feel stronger.
Great. So if anybody would like to get more fit, get rid of pain, and get either a 6-pack after pregnancy like Carrie, or just get back to normal, regular life so that you can more fully enjoy it, spend time with your kids, look these two ladies up. I'm sure they'd be able to help. All right. Bye, everybody.
Thank you for listening to the Fit and Healthy Denver podcast, brought to you by Kinetic Chain Denver Physical Therapy. If you know anybody that you think would benefit from listening to this podcast, please share it with them. And don't forget to hit that subscribe button so you can enjoy all the great information we're bringing you in the next episode.